Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Nigeria Association of Resident Doctors suspend 2-month-old strike amid declining figures for COVID-19 cases. Edo confirms reduction in positive cases, warns residents to ensure they complete full doses of COVID-19 vaccines. And UK's new simplified travel system of arrivals for the rest of the world kicks off. The country has recorded relatively low cases of COVID-19 since the past 2 days, below 100 cases and no deaths recorded. The latest positive samples of COVID-19 were reported in 8 states and the FCT, according to the Nigeria Center for Disease Control. 74 people tested positive for the coronavirus, with Lagos leading the infection chart, while more patients were also discharged on Sunday after recovering from the infection. A total of over 3 million tests have been conducted thus far among Nigeria's population. Here's a look at the virus update.
Employers have a duty to reduce workplace risk at the lowest level by taking preventive measures. The NCDC is advising Nigerians to ensure non-pharmaceutical measures in all public and religious settings to curb the spread of COVID-19. 74 additional persons in Nigeria have tested positive to the virus in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT. This is a decrease from the figures reported earlier. Lagos logged the highest number of infections with 36 cases, followed by Edo, which had 11. 9 were recorded in the FCT. Akwa Ibom and Sokoto registered 6 each. Delta had 3, while Benue, Oyo, and Rivers logged 1 case each. There were 0 cases reported from Bauchi, Ekiti, Gombe, Ondo, Ogun, Osun, and Plateau states. The overall count of confirmed cases in Nigeria now stands at 206,138. 204 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 194,097. Lagos is still topping the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Edo, and Oyo State. There were no new deaths from COVID-19 complications in the last 24 hours, leaving the fatality toll at 2,723. Presently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. Over 4.9 million eligible Nigerians targeted for vaccination have been reached with the first dose, while over 2.1 million persons have been fully vaccinated so far. In Africa, there are more than 8.3 million confirmed cases and over 212,000 deaths have been recorded across countries on the continent. The total global confirmed cases have now surpassed 234 million, while deaths are beyond 4.8 million.
And after 2 long months, members of the Nigeria Association of Resident Doctors (NARD) have suspended their strike, albeit conditionally, citing the intervention of the President and the Vice President as the basis for the latest decision. President of the association, Dr. Godiya Ishaya, told journalists at a news conference in Abuja that the suspension is a majority decision by members after their meeting on Sunday to review the progress made so far. According to him, if the issues that led to the strike remain unaddressed, the association will reconvene after 6 weeks of the suspension.
After critical appraisal of the performance of both federal and state government on all the issues that led to the ongoing strike as stated above, progress made in implementing previous agreement reached with the federal government, the intervention of His Excellency, the President of the Federal Republic of Nigeria, the Vice President, the Honorable Minister for Labor and Employment, NEC resolved by vote of a simple majority to suspend the total and indefinite strike action embarked upon on 2nd August 2021. Therefore, our members will resume full work on Wednesday, 6 October 2021 by 8 a.m. The NEC urged the federal government to reciprocate the good faith and trust shown by the association by ensuring the following: continuous processing and payment of the ongoing 2021 and 2020 medical residency training fund. If after that 6 weeks there's no meaningful progress, we'll still have to revert back to the National Executive Council, and those issues will still be considered and appropriate position will be taken.
Over to Edo State, where the government says there is a decline in the number of positive COVID-19 cases with more recoveries, but adds that Nigeria is not out of the woods yet. The permanent secretary, the Edo State Ministry of Health, made the observation at the daily COVID-19 briefing, where he warns residents refusing to complete their 2 doses of vaccines. He says they are putting themselves at risk. According to the statistics from the last 5 days, Edo State has detected 84 new cases, recorded 130 recoveries and 5 deaths.
We have had a downturn in the number of persons in our various facilities. If you look at what we had in Stella Basinjo, it's quite far below what we used to record there, and even our home-based cases are also reducing in number. But the point is that there are still cases in our state, and we need to pick out those cases and monitor them and possibly isolate them enough for us to return back to normalcy within the state. The vaccination is still ongoing. Also, even though the figure wasn't given out here now, we have had a low turnout for vaccination, for which, even if we were to be coming out of the woods from the COVID pandemic, we need people to be vaccinated so that we don't have another wave coming back here, or a 4th wave, which is the possibility after a wave that has just passed. And the only way we can reduce that and prevent that is to have our persons vaccinated. People should see the vaccination as not a government venture, because some people feel it's just to possess a card. Some persons are taking their first shot and are withdrawing from coming for the second shot. And that is not the best of things to do. Because if you are not fully vaccinated, your immunity will not be as good as is expected. So it will be a false relief to believe that you are now protected fully. That means that person is still going to be at some level of risk higher than for that of the persons who are fully vaccinated.
Meanwhile, as the onslaught against COVID-19 continues across the country, radiographers have called on diagnosis centers to stop sharp practices or face the wrath of the law. The Radiographers Board of Nigeria, under the Federal Ministry of Health, sounded the warning during a week-long monitoring and enforcement exercise in Ibadan, the Edo State capital. The association began monitoring and enforcement of standards in diagnostic centers across the country with a view to ensuring that diagnoses are accurate for patients to discourage quackery.
Radiographers Registration Board of Nigeria on a monitoring exercise to check and regulate the activities of personnel that carry diagnosis of various illnesses. The leader of the enforcement team says the aim is to ensure best radiography practices across the country.
The essence of the exercise is to get rid of quacks, those who operate radiographic equipment and without undergoing the proper training, without being registered and without being licensed.
While emphasizing the need for accurate diagnosis in the treatment and management of COVID-19, he also warns members of the public to be mindful of diagnostic centers and hospitals they patronize.
The somatic damages can be in form of skin burn, reddening of the skin, which we call erythema. There may be epilation where the skin starts to peel off, and if it's the gonads, it can lead to temporary or permanent sterility. Also, the abuse of use of ionizing radiation can lead to cancers, cancer of different forms. So that is why it is important that the profession is regulated and those who practice it are put under check.
So far, 18 facilities have been inspected, out of which 7 substandard diagnostic centers and hospital facilities have been sealed. and 8 arrests made in Ibadan, the Edo State capital.
Last week, the World Health Organization said that just 15 out of 54 African countries had fully vaccinated 10% of their populations against COVID-19. The announcement that more than 70% have missed the World Health Assembly's target indicates that there is a struggle to narrow the large gap in vaccine access between poor and wealthy countries. Dr. Jamiu Ganiu, a public health physician, joins us for more on this on the program virtually. Thank you for joining us. Tell us, what are the risks that these countries face falling way behind the WHO target?
Thank you very much for the question. It's 10% of vulnerable that ought to be vaccinated at the end of September 2021. It's not really it's mainly targeting the vulnerables, and that is 10%. If you look at among those 15, based on the report, majority of those people that are able to achieve the 10% were mainly those countries with a smaller population. For instance, we are talking of countries like Lesotho, Botswana, South Africa, and so on. But when you look at the country with a bigger population like Nigeria, Ethiopia, and Egypt, is that population is a key factor. They are yet to meet. Like Nigeria has less than 3%, Egypt around 5%. So it's more relatively the population actually has been attributed to one of the factors. And apart from that, getting this vaccine currently, especially for Africa, they've not been able to meet the target in terms of supply. Currently, out of over 5 billion doses that have been distributed, Africa were mainly giving about 2 to 3%, which is actually a big problem. And before now again, we in Africa, we depend on either donation, on a COVAX scheme distribution, or based on the individual country negotiation with the manufacturing company. But unfortunately, if you are following antecedents, you find that the major supply of these vaccines is Serum Institute of India. Sometime in April, they had an issue. There was a serious outbreak, increased number of cases in India. As a result of that, they have to suspend exportation so that they can take care of their own people that are being affected. And hopefully, they hope to resume by October to continue, producing those vaccines. And even when hopefully they resume in this month, it has been said that they will first deal with the Asians and the COVAX. But I want to let you know that depending on donation, COVAX scheme has been one of the actually limiting factor that has made Africa to, at present, the average vaccine coverage in Africa is about 4.4%, compared to Europe with 66%, 62%, UK,
and other regions.
66%.
Dr. Ganiu, I must quickly ask you, I mean, although Africa's third wave peaked in July and the decline in new cases appears to be a bit slower than the previous waves which we've had, and statistics is showing every hour 26 Africans are dying from the virus, is there a threat that, there could be new variants, and this is with the vaccine's delay?
No, what is possible, but currently you know that we have 3 basic variants actually, causing transmission in African countries. The Delta, which is there. We have the Beta and we have the Alpha. So, well, it's possible, but the only painful thing is that there is a general hoarding of these vaccines by those countries who can afford it, and that has been a major problem. And even, the global target for this vaccine has been stated is 40%. It is expected that at the end of 2021, we should be globally we should achieve 40% coverage. But unfortunately, it's possible to have already there is a suspicion of a new variant, but it has not been established, because what determines a variant has to do with the increase in transmissibility, the severity, and the ability to actually affect the vaccine protection. But the current one, C12, up to now is still under study. There is not any evidence that yes, it can cause any further problem at the moment. Yes.
We always appreciate your time on the program. Dr. Jamiu Ganiu, a public health physician, thank you for joining us.
Thank you very much. Yes.
The Ogun State government says its engagement with critical stakeholders, which include traditional rulers, opinion leaders at community and local government levels, has boosted residents' confidence and reduced hesitancy among them over COVID-19 vaccination. The executive secretary of the state's Primary Health Development Board said that the engagement has resulted in voluntary vaccination. While asking residents to keep up the tempo, he also reiterated the need for residents to ensure strict compliance to the non-pharmaceutical protocols.
Ogun State have been able to break the chain of hesitancy. If we go to Kelewo on a good day for COVID-19 vaccine, before now you see 100 people waiting to receive the vaccine. And this is happening across the 20 local governments of the state. The Honorable Commissioner approved the commencement of second dose vaccination in Ogun State. And as we speak, all the 20 local governments are currently vaccinating with Moderna vaccine and AstraZeneca vaccine. So for this second dose, we have over 89,000 doses to cover at least the over 86,000 people that got the first dose of Moderna. And we have also received 80,000 doses of AstraZeneca to cover the backlog of people that have had their first doses, and also to make sure that people that need first dose are given.
And away from Ogun State, the spread of COVID-19 pandemic in Katsina, northwest Nigeria, has reportedly reduced to the barest minimum, with 0 case recorded in the state's isolation centers. A nurse in charge of the newly established NCDC Isolation and Treatment Center at the Federal Medical Center Katsina disclosed in an interview with Channels Television also explains that during the peak of the pandemic, a lot of patients were being attended to. He says that the center has, within the last 3 months, admitted only 3 patients, with none on admission at the moment. And away from Nigeria, new simplified travel rules have come into force in the United Kingdom, with the traffic light system replaced by a single red list. Most fully vaccinated travelers arriving from non-red list countries will no longer have to take a test before setting off for the UK. Airlines UK said it would make traveling abroad easier and cheaper, but those coming from red list destinations must still pay to quarantine in a hotel for 10 days. Dr. Estienne Ukorobi, GP Registrar at Worcester Royal Hospital in England, is with us now. He joins us virtually. Thanks for joining us on the programme. I mean, under the changes which came into force for 4 o'clock British summer time, the green and amber lists have been scrapped. It is great news for travel companies and airlines and families who might be getting away for the Christmas holiday. What are the reactions to the decision?
It's true that today the amber list was scrapped and replaced with a single red list that's talking about the UK's traffic light system. And I think that's good news, especially for the fact that countries like Nigeria was previously on the amber list, but that list no longer exists at the moment. So we only have countries in the red list, and I think there are about 54 countries currently in the red list, which with countries like South Africa, Brazil, and Argentina. And those coming from the red list countries at the moment would need to quarantine in a designated hotel for 10 days, and they would need to pay for the bills of the quarantine, which is somewhere about £2,200 per person. So it's a good news for people who were previously on the amber list, like Nigerians, and it makes travel easier, and it makes the logistics surrounding, testing before traveling a lot more easier.
And Dr. Ukorobi, talking about testing, the rules are also being eased, and this is, like you've mentioned, people traveling from non-red list destinations. And then there's also any of the 18 other recognized countries. it almost sounds as if it's all uhuru. Things are as good as back to normal in England.
Well, I would say we are gradually walking our way back to normal, as you can see clearly in the gradual restrictions of these travel rules, as well as the testing rules. And, correctly said, the testing rules have also changed. So fully vaccinated individuals who have received their vaccines in countries like the United Kingdom, the US, or countries in the European Union would no longer have to do the 72 hours pre-travel COVID test. They would no longer need to self-isolate on arriving in the UK, as well as towards the end of this month, they would no longer have to do the day 2 COVID test. So that takes us back to pre-pandemic times. And I think, like you said, we're gradually edging towards normalcy again.
Finally, the Transport Secretary is quoted as saying the priority remains to protect public health, but with more than 8 in 10 people now fully vaccinated, we're able to take these steps to lower the cost of testing and, of course, to continue helping the sector to recovery. So having reached perhaps what a lot of people are calling herd immunity, where do you, or perhaps what are the expectations from governments, and this is ahead of winter?
It is true that about 8 in 10 persons currently in the UK are vaccinated, and figures show that the link between hospitalization, rise in cases and deaths have been weakened significantly since the start of this pandemic. I think the winter period is quite an important period for us here in the UK, and there's a lot of anticipation as to what the winter period will bring. And I think the government, on their part, are working towards managing the situation of the pandemic come the winter period. And I think they plan to do this through boosting the immunity of the UK population. And the plan currently is to do this through 4 different means. The first is to sort of maximize the vaccine take-up in individuals who are eligible for the vaccine, but for some reason have not had the vaccine or have refused to take the vaccine. And the second plan is to offer sort of booster doses to individuals who were part of the phase 1 vaccine program. So talking about the over 50s, those with comorbidities and health problems, frontline workers, those who live and work in the care home, and things like that. So they would be offered a booster dose in addition to the first 2 doses that they have received. Also, the government has rolled out what we call the 3rd dose of the COVID vaccine, and that's to individuals that have been identified by their GPs or by their doctors as having weakened immunity as a result of one illness or the other. They can receive a 3rd dose of the vaccine. And finally, the vaccine has also been rolled out to younger children, so ages 12 to 15 can now receive the first dose of the COVID vaccine. So doing all of this would go a further step in boosting the population's immunity and hopefully help to tackle the situation come winter period.
And we'll be watching to see how all those play out. We appreciate your time on the program. Many thanks, Dr. Esin Ukurebi, GP Registrar, Worcester Royal Hospital, England. Thanks for joining us again.
Thank you very much.
India Supreme Court has approved for the government to pay 50,000 rupees, that's $674 to families as compensation for every death due to COVID-19. We have that story and more on the Global Update.
The decision by the Indian Supreme Court comes as the World Health Organization says nearly 6.19 billion doses of vaccine have been administered across the world, with many countries seeing a notable decline in COVID-19 infections. Also, the WHO says the cumulative total of global COVID-19 cases has exceeded 233.5 million, with the death toll hitting 4.77 million as of Friday. Staying with vaccinations, China has administered over 2.213 billion doses of COVID-19 vaccines as of Sunday in the 31 provincial-level regions and Jiangxi production and construction core by the end of Sunday. Beijing had registered more than 40.12 million doses as of Sunday, with over 20.4 million people having been vaccinated. Meanwhile, in Thailand, students in the capital Bangkok have been taking the Pfizer jab ahead of schools reopening in November. Nearly 90% of over 35,000 students have registered for vaccination. Bangkok hopes to distribute both doses by the end of October, so says the Bangkok Metropolitan Administration Governor Aswin Khamuang. Finally, New Zealand has abandoned its strategy of eliminating coronavirus amid a persistent Delta outbreak and will instead look to live with the virus and control its spread as vaccinations rise. The Pacific nation was among just a handful of countries to bring COVID-19 cases down to zero and largely stayed virus-free until an outbreak of the highly infectious Delta variant in mid-August frustrated efforts to stamp out transmission.
Quite an interesting strategy. We'll continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic, and several breaking stories is channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.